This film demonstrates the protective measures that should be taken when working with patients with suspected or confirmed COVID-19. To prevent viral contamination of the hands and the subsequent risk of transmission, hand hygiene is essential. If the hands are visibly soiled, they are best cleansed with soap and water. If the hands are not visibly soiled, an alcohol-based hand rub is best used. How to practice hand hygiene using an alcohol-based hand rub is now shown. First, a palmful of alcohol-based hand rub is applied and all surfaces of the hands are covered. Next, the hands are rubbed palm to palm. The right palm is rubbed over the dorsum of the left hand, with fingers interlaced, and vice versa. The fingertips are then interlocked, and the backs of the fingers are rubbed on the opposing palms. The thumbs are disinfected specifically, through rotational rubbing using the opposing palm. The digits are flexed, and the fingertips clasped together and rubbed rotationally in the opposing palm. The entire procedure should last 20 to 30 seconds. Once dry, the hands are disinfected. Hand hygiene should be practiced in the following situations: before touching a patient, before performing any clean or aseptic procedures, after exposure to body fluids, after touching a patient, after touching a patient's surroundings. Respiratory hygiene should be explained to all suspected COVID-19 patients. They should wear a medical mask when in a public or waiting area and cover their nose and mouth with a disposable tissue or the elbow when coughing or sneezing. All suspected or confirmed COVID-19 patients requiring hospitalization should be placed in isolation in an adequately ventilated single room, ideally with an anteroom. Moving and transporting the patient should be avoided unless medically necessary. When transport is necessary, use predetermined transport routes and have the patient wear a medical mask. The following personal protective equipment should be worn when in contact with patients with suspected or confirmed COVID-19. A medical mask, eye protection, a non-sterile, long-sleeved gown, and non-sterile gloves. Whenever possible, single-use disposable equipment is used. Non-disposable equipment, for example stethoscopes and thermometers, should ideally be dedicated to a specific patient and be left in the patient's room. When equipment needs to be shared between patients, it should be cleaned and disinfected between each use. During aerosol-generating procedures, additional precautions should be taken. The following are considered aerosol-spreading procedures: tracheal intubation, non-invasive ventilation, tracheostomy, cardiopulmonary resuscitation, manual ventilation before intubation, and bronchoscopy. The healthcare worker wears the following personal protective equipment during aerosol-generating procedures: a particulate respirator, N95 FFP2 or equivalent, eye protection, a non-sterile long-sleeved gown, and non-sterile gloves. The personal protective equipment should be put on in a safe area, without risk of exposure. Ideally, this is in an anteroom. If the patient's room does not have an anteroom, the personal protective equipment should be put on outside the room. The following equipment is collected and placed in a safe area where the donning of personal protective equipment will take place: hand alcohol, gowns, appropriate masks, eye visors as seen here, alternatively goggles or a face shield may be used, and non-sterile gloves. All jewellery is removed and all items are removed from the pockets. If the healthcare worker has long hair, this is tied back. Additionally, a hair bonnet may be worn. Before putting on the personal protective equipment, hand hygiene is performed. First, a gown is donned, following the manufacturer's recommendations. The appropriate mask is put on. For general care, this is a medical mask. When performing an aerosol-generating procedure, a particulate respirator, N95, FFP2 or equivalent, must be used instead of a medical mask. A particulate respirator is put on. The top strap should be placed over the occiput of the head. The bottom strap should be placed at the nape of the neck, below the ears. The strap should not be crossed. Mould the nose piece to the bridge of the nose so that the mask fits tight to the face. Next, a seal check needs to be performed to ensure no air is escaping from the sides of the mask. This is done by breathing in and out deeply while holding your hands next to the mask to feel for escaping air. An eye visor or goggles is put on. Alternatively, a face shield may be used. Finally, non-sterile gloves are donned. The gown should be tucked into the gloves completely and no skin should be exposed. To ensure this, the gown cuffs may be pulled down to the knuckles of the hand when putting on the gloves. Personal protective equipment should not be adjusted over the course of the patient contact, so it is important to ensure that the equipment fits comfortably. Personal protective equipment should be removed in a safe area, ideally in an anteroom. When such a room is not available, the equipment should be removed inside the patient's room, where it is safe to do so. The mask should be worn until outside the patient's room. The gown is removed inside out and away from the body by rolling it up. First, the tie at the back or the side is loosened. The gown is then pulled at the shoulders to break the tie at the neck. Finally, the gown is pulled from the shoulders away from the body and rolled inside out. Care should be taken not to let the contaminated side of the gown contact the clothes. The gloves are removed by pinching the glove of one hand at the wrist, and the glove is removed by turning it inside out. Next, the index finger of the ungloved hand is slid under the edge of the glove on the other hand, at the wrist. Make sure that only the inner surface of the glove is touched. Hand hygiene is practiced after removal of the gloves. The eye protection is removed by bending slightly forward and grasping it at the sides or back of the head. Remove the mask or particulate respirator by bending slightly forward and pulling it from the back of the head. When a particulate respirator is used, the bottom strap is pulled over the head first, whereafter the top strap is pulled over the head. When the patient's room does not have an anteroom, the mask or particulate respirator should be removed outside the patient's room. The equipment is removed away from the face and placed gently into the waste container. Finally, the hands are disinfected again after removal of all personal protective equipment.